we have now. Yes?
So this is just a schematic drawing, actually, showing the lungs. On the right side, we have three lobes on the right side where the tumor is. The tumor is actually on the right upper, and we have the left side, which seems normal.
So the tumor can be located in any of those three lobes,
right,
or whether right or left, or both sides.
Yes, you're absolutely correct.
Yes, just this is an example of one of the tumors located in one of the lobes.
Right, that's correct. Now, this is just, a very expressive picture which shows that, lung cancer is usually associated with smoking, or the other way. So almost 85% or 90% of those patients present with lung tumors are associated with smoking. Right. I have to, this is how it looks. I'm sorry, probably this is a really terrifying picture. But
I want more terrifying pictures if you have to frighten them.
But, again, I keep stressing on smoking. I keep stressing on smoking.
It's never enough to be stressed on this topic.
No,
yes,
it's really a fatal habit. Now, this is how it looks. This is chest X-ray. One of the patients who presented with a cough with a little bit of blood. And after the X-ray, it showed that there is a tumor. If you can...
with that big size, I mean, it's amazing. Like just single episode, yes.
Yeah, it's a huge tumor, actually, and it needs to be evaluated more. So we did the CT scan. Now, this is a very irony type of picture. This guy presented with the chest lesion, a lung cancer. And he went for a CT scan with his pocket of cigarette, like a pack of cigarettes inside his CT scan.
Yes, the picture shows such, yes.
Yeah, which is really
it's
not
an
a
iron,
good thing.
yes, yes, in a sarcastic way.
Right. Now, I mentioned that after biopsy, I would like to know whether there is an extent of the disease or not
to the lymph nodes,
yes, or other part of the body. So that will
examples like liver, spleen, brain.
Yeah, those are the major organs. Either the lung, the same lung, or the other lung, lymph nodes, livers, brain, and bones.
Yes.
Those are the major major sites. Now, this is a recent technology called the PET scan technology. It's part of our investigation. PET scan is a radionuclear study. They just inject the glucose inside your vein, and then they have a special camera.
And this is routinely done for all patients who are diagnosed?
Now it's a routine for lung cancer to do a PET scan, PET associated with CT scan, actually.
Yes.
And as you can see, the arrows actually shows that the right upper lobe of the right lung, there is a lesion there, and it just it lights up with the PET scan.
Yeah, so this is very informative tool for staging the disease, and then accordingly you will go for the management plan.
That's correct.
We want to answer some of the questions. Actually, I would like to thank Mr. Abdul Wahab again, who called us, and he's asking about the way you treat lung cancer surgically, and you are going to explain how, but specifically also he wants to ask if you do it using laparoscopic technique with the camera only, without the usual open chest surgery. This is one thing, and there's another question that we will answer soon about the use of chemotherapy and radiotherapy in Kuwait. So let's start about the ways you remove or treat lung cancer.
So let's assume that this patient is free of diseases anywhere, and is spread or metastasis. We call it medically metastasis. Then we plan for a resection. And in order to do the resection, we have to make sure that the patient himself, not the disease, but the patient is going to tolerate the procedure or not. For example, some patients, they are the lungs are not really healthy, or the hearts are not really healthy. They cannot tolerate the anesthesia. So those patients will not undergo surgery. How do we identify those patients? By doing an X-ray investigation, by doing a pulmonary function test to assess the function of the lungs, and we do also an ultrasound of the heart. to assess whether the heart will tolerate the resection or not.
So those techniques or investigation tools are done routinely for all patients diagnosed with lung cancer to assess their general condition prior to deciding what method you will use to treat their cancer.
Yeah, that's correct. That's
okay.
absolutely right.
Yes.
And now, if the patient basically turned to be a good candidate for surgery, and the lung tumor or lung cancer is resectable, then we have to tailor what type of resection. We have 4 types of resection. If we can see
if you can see it on the pictures shown on the monitor.
Right.
Yes, like you said, if the lesion is demarcated, well localized, so it's easily accessible and you can remove it. It's part of the lung, right? You have picture.
It is part of the lung, but you know, again, every patient has, like, you know, a specific treatment.
Yes.
We can't really generalize.
Yeah, we are just saying the general options, but if, like you said, it's every patient has his own tailored management plan.
Yes, definitely.
Yes.
Now, we have something called wedge resection, where we remove, that's the top picture on the left side of the screen, when we remove only the lung with some healthy tissue around it. Okay. Okay, and this is...
you mean part of the lung, the tumor itself?
The tumor and a little about
a clean edge.
Yes, a clean edge. And this is, we do it basically for those patients who are not really, or cannot really tolerate a bigger resection. Now, the second one is what we call anatomical resection. That means that we take a segment of the lung with its blood supply and with the airway.
And it could be a lobe, a whole lobe from the lung, or it could be less than a lobe?
It could be less than a lobe. It's only one segment of the lobe. The lobe has many segments.
Yes.
Okay.
So we want to explain what do we mean when we said segments, because patient might think that we are taking the whole lobe.
Yeah, no. The segment is defined basically that, you know, the part of the lung that has its own blood supply and its own bronchus.
So this is, sometimes we are amazed by the anatomy of the lung. Now I can see why you are fascinated by the anatomy and the structure of the thorax. Like you said, God have created it such in a way that even you don't have to remove the lung, the anatomy itself makes for surgeons more accessible to take a segment with its own blood supply, like you said. It's something very beautiful.
That's correct. The second, or the other part, or other type of procedure is lobectomy, which is a little bit more extensive. And we do it for those patients who can tolerate removing one part of the lung. For example, they don't have a heart disease, or their lung function are really good enough to remove this lobe. And this is only an example there on the screen, on the top bottom, on the left side. Okay. Sorry, left side, bottom side.
And then you can go further. Can you remove the whole lobe, or more than a lobe, like you said, or a whole lung?
We can remove... Yeah, we can remove the whole lung, but not both lungs, of course.
Yes.
Okay, we can remove whole lung, that's correct. People can live with only one lung.
Okay, this is something we want also to pursue it as a message, because people think sometimes with such a big lesion, even if it was on one side, and you are going to remove that whole lung, that might jeopardize their health or affect their survival.
Well, removing the lung is not an easy thing to do, actually. I mean, it's a major surgery, but not everyone will tolerate that.
Yes, so accordingly to what you said earlier, and Dr. ضرار, that you always assess the patient prior to doing this. We always emphasize on this point.
That's correct. That's correct.
Now, there was a question from our viewers saying, now you removed one whole lung, lung from one of the sides, whether right or left. Left. Still patients, like you said, after you have assessed them, they are able to survive. So people can live with one lung. The question came saying, does the lung tissue grow back? So if you remove part of the lung, not the whole lung.
Yeah, that's a fair question, but unfortunately, no.
Because we know that for the liver, sometimes it does happen.
That's correct. That's
but what about the lung?
No, the lung doesn't, it actually doesn't really grow back. But what's the amazing thing that happens is the other part, which is left in the lung. For example, if we removed one lobe, a whole lobe of the lung, the other lobes takes over the removal.